through a couple things quickly here on Saturday before we watch a movie. Provisional death counts for coronavirus disease. This is off the CDC website, published as of yesterday, so as of May 1st. The provisional counts for coronavirus disease deaths are based on a current flow of mortality data in the National Vital Statistics System. National provisional counts include deaths occurring within the 50 states as well as District of Columbia, as long as they've been received and coded. It's important to note it can take up to several weeks, etc. That's not the case for this COVID thing because hospitals, providers are getting paid based on things being coded a certain way. In other words, being coded with COVID-19, anywhere from $13,000 minimum up to about $42,000 if they need to use a ventilator. So they're incented to get these numbers in. So there's no way there's a 2-week lag. I'd be surprised if there's more than a day lag. Death counts for earlier weeks are continually revised and may increase or decrease based on death certificates, et cetera, et cetera. The provisional data presented on this page include the weekly provisional count of deaths in the United States. Now get ready because they give it a lot of categories. Due to COVID-19, deaths from all causes and percent of expected deaths. So based on a forecast. Hopefully it's not the Dr. Fucky model that is used for COVID-19 or the pandemic. Would be in trouble if that were the case. Number of deaths received over number of deaths expected. So again, it's a formula based on previous years. Pneumonia deaths excluding pneumonia deaths involving influenza, pneumonia deaths involving COVID-19, influenza deaths, and deaths involving pneumonia, influenza, or COVID-19. So let's look down at the table. As of May 1st, right? So COVID-19 deaths, 37,308. You might be able to throw in the 16,000 here. I don't think so because it's pneumonia and COVID-19, but let's say that you could. That's 53, 53,000 deaths. Then you have 5,848 deaths due to influenza or the flu. That's impossible. We haven't had that small number of deaths for the flu in 100 years, over 100 years. I mean, we're minimum 20,000 flu deaths every year, minimum. 2 years ago, we had 80,000 flu deaths. So to say we have in May, as of May 1st, 5,846 influenza deaths is completely ridiculous. And frankly, it's absurd. And then deaths from pneumonia, influenza, or COVID-19. So that's comorbidities. 90,165. So 37,000 COVID-19 deaths, 37,308. These are clearly due to COVID-19. That's what that number's supposed to represent. So if I come over here and I look at the world count it's actually as of today. So it's a little bit, I think it's as of today. It might be as of now. So no, this is as of today. So the world total deaths, USA total deaths, 67,410. 67,410. Yet the CDC has 37,308. And it's pretty hard to come up with a machination of numbers, subsets of these numbers over here on the right, to get to the number 67,410. So you really can't believe anything you're being told as it relates to the numbers. By the way, if that's accurate, the 37,000, based on the fatality rate would drop by about a little over 40%. So whatever the death rate is, and it's a moving target, but going down, whatever it is, that's down about 40% based on this number here. The CDC, they're the ones responsible for these numbers, so they can't really point to somebody else and blame somebody else. These are their numbers that they collect. They scrub, as Dr. Burke said in one of the pressers several days ago. They make sure that there's another level of codifying the certificates done by sort of the CDC staff or some NGO that's related to the CDC, that they make sure that things are coded correctly. So these numbers are inflated so badly that you got to wonder, and it's going around the web by a lot of people, including some doctors, some well-known physicians. Is this even a thing? Is this COVID-19 even a thing? Or is it completely fabricated? And I'll tell you, when you see this kind of discrepancy, and then you've been tracking it for 6 weeks, like, how can you not be? You got to wonder. So enough on the COVID stuff here. It's depressing. 67,000 versus 37,000. So a drop of, like I said, about 40% or so. One other thing I wanted to jump into here and show these. I think I can show them pretty easily. Right. So here's a map of the states that have imposed measures designed to stop routine travel to slow the virus's spread. Complete bullshit. But that aside, if you look at these states, the blue ones are the ones that have the most draconian measures, comprehensive restrictions on business and travel. Idaho, that's a Republican state, Republican governor, and a Republican state. So it's surprising. Idaho had a protest as well. Of course they did. New Mexico, Democrat governor. Kansas, Democrat governor. Ohio, I believe, is a red state, so that would be a Republican governor. West Virginia is a blue state, so that's our friends, the Dems. So basically all these but 2 states are Democrat governors. Now, if we look at the states that are gray, Utah, North Dakota, South Dakota, Nebraska, Iowa, and Arkansas, they're all have the few to no restrictions. So basically they didn't do anything or very little. They are all Republican governors. Every single one of them. Utah, North Dakota, South Dakota, Nebraska, Iowa, and Arkansas. They are all Republican governors. And those states, and I don't have the death rates in front of me, but have lower than average death rates. Now, it's skewed because New York and New Jersey are cheating on the numbers just to get the money. So it's hard to say, other than these states are really low compared to any of the other states. Now, these aren't real populated states, North Dakota, South Dakota, but Arkansas, Utah, they have some reasonable population. So does Nebraska in the big cities, Lincoln, etc. So anyway, I thought that was pretty interesting. And there's one other thing I wanted to pop up here. And this is the Democrat or Republican breakdown of governors. So as you can see here, and I might be able to get, it's a little hard, to get both of them up on the screen at the same time. But this is a good overlay that tells you what one of these states are governors are Democrat or Republican. Right now, I think the lead is 27 to 23 Republican states governors to Democrat states, I think. I'm pretty sure that's the case. And I know right now, in terms of a trifecta, the Republicans, it's like 12 to 8. So 12 states have the House, the Senate, and the governor Republican. 8 states have the House, the Senate, and Congress, or the governor, as Democrats. So California is one of those trifecta states. No surprise. New York, another trifecta state. So all you got to do is look for the states that are the most dysfunctional, the most crooked, and you will find more than likely a Democrat trifecta. So, okay, that's it. Saturday night. I'm out. Be good. like, subscribe, and comment. I really do want the comments. Later.